In last year's budget, the health sector was allocated 900 billion shillings, a sum that translates to 9% of the Uganda's total budget allocation. Although the allocation increased from the previous year, it still fell short of the 15% that heads of state from African countries pledged to allocate to their health sectors in 2001 at the Nigerian capital, Abuja. Uganda is a signatory to the Abuja Declaration.
Our basic requirements for this country, according to calculations, is that we need at least $40 US per person per year to get what is basic. We actually don't know how much eventually reaches the people to provide the service. It could be less than $10. So that would be about maybe 20 or 15,000 Uganda shillings per year. And that is very, very small amount of money.
The target of this financial year's budget is to address poor child and maternal health, weaknesses in the drug management systems, inadequate health infrastructure and personnel constraints. A number of Western countries have partnered with government to bridge the gap in the health sector. Some of them are the Spanish government, which pledged to rehabilitate Kawolo and Itojo hospitals this financial year. Another is the Italian government, which promised to build 88 staff houses for health workers in the Karamoja region. But according to the Ministry of Health officials, the funding agreement with the Italian government is the only one that has so far been signed.
We need a funding mechanism that is predictable and that is stable.
Coupled with such delays are the weaknesses in the health system that have on some occasions caused the available funds to be poorly allocated.
Money gets lost through poor management. Many of our administrators are not trained people, and the people who make resource estimates at health facilities are not well trained. So all the things that they are trying to manage are actually not efficiently managed. So we end up losing much of that small money.
But it is not too late for Uganda to decrease on its disease burden, in which about 170 of every 1,000 people are sick. The authorities reckon that with proper planning and sensitization, infectious diseases like HIV/AIDS, malaria, cholera, as well as the non-communicable ones like cancer and diabetes, to mention but a few, could be drastically reduced.
You must link resources to input and then outputs and then impact. That means you create a result chain. The money which must go to do something must pass through processes that are clearly visible. So if it will not address an impact somewhere, then that money should be returned into the treasury and should be monitored and kept and becomes a reserve, national reserve.
The officials say that they are also closely monitoring the funds injected in the health sector. Recently, the Belgium government donated 6 ambulances and 5 utility vehicles to all referral hospitals in the West Nile region to enhance its operations.
Arua is one of our districts well known for poor management of fleet vehicles. I wouldn't want to see this happen, especially with what we are giving you today. I will direct that every 6 monthly, Dr. Zati, that you get reports of these vehicles, how they are doing and how they are maintained, so that our sanctions of withdrawal or punishment can be effectively done.
The officials also say focusing on preventive health in Uganda can go a long way in decreasing the disease burden.
Public education. Many people don't know that these diseases can be prevented because they don't have the information. So we need a deliberate effort by government and by institutions, even private institutions, to begin to educate people about various diseases, both communicable and non-communicable diseases.
Increasing health funding has always been a gradual process even in developed countries. But health analysts believe before a country gets to that desired position, its technocrats ought to properly use the available funds to create a great difference. Irene Namyalo, NTV.